like insulin, they are produced by beta islet cell of pancreas. So, and they act at a distant site from where they are produced, right. Now, coming to autocoils, they are called local hormones. Why local hormones? They are produced by a variety of cells in the body. They have got diverse action. দেখো প্রত্যেকটা বইতে লেখা আছে রে, নোট করার কিছু নেই, হ্যাঁ সব পেয়ে যাবি। আচ্ছা, যেটা রয়েছে তোমাদের অটোকয়েলস, এটাকে লোকাল হরমোনসও বলা হয়। কেন? বিকজ দে অ্যাক্ট where they are synthesized and released. হরমোনস ডিস্ট্যান্ট অর্গানসে কাজ করে যেখান দিয়ে প্রডিউস হয়েছে, while the autocoils they act at the site where they are formed and released. Number one difference from the hormone. Number two, hormones they are produced by a specific type of cell, while the autocoils they are produced by a diverse group of cells from different parts of the body. So, autocoils is formed by two Greek words, autos meaning self and akos meaning healing. That means the self healing substance. Autocoils are diverse substances produced by a wide variety of cells in the body having intense biological activity, and they act where they are produced and released. They are also called local hormones. So, what are the difference between an autocoil and the hormone? Autocoils are produced by different variety of cells unlike hormones, and they act at the same site where they are formed. So, they are local hormones. Now, examples of autocoils, these include amine autocoils like histamine and 5-hydroxytryptamine, also called serotonin. The second is one lipid derived autocoils that include prostaglandins, leukotrienes and platelet activating factors. And the third group, that the peptide autocoils, they include plasma kinase, which include bradykinin and calidin, and definitely angiotensin. Now, the first one, histamine, is a class for today. Histamine and antihistaminics. বোঝা গেছে? কি হলো? Now, coming to the histamine. Histamine is an autocoil formed from the Greek word histos meaning tissue. The word histamine means tissue amine. Chemically, the histamine is beta imidazolyl ethyl amine. Okay. Now, the tissues rich in histamine are skin, gastric and intestinal mucosa, and then lung, liver and placenta. Even they are present in the blood and the body secretions and the venoms. Now, histamine is stored primarily in the mast cells within the mast storage granules. How they are stored? Histamine are basically positively charged, and they complex with the negatively charged particles including heparin, and they are stored in the granules of the mast cells. Okay. They are present mostly within the storage granules of mast cells. Some of them are also present outside the mast cells in a different cells. So, non-mast cell histamine occurs in the brain, skin epidermis, gastric mucosa and growing regions. Now, in the mast cells, as they are present in the storage granules, the turnover of histamine in the mast cells are slow, because till the storage is exhausted, histamine is not required. So, turnover of mast cell histamine is slow, while that of non-mast cell histamine is fast. Now, these are the basically flow chart showing the synthesis, storage and the metabolism of the histamine. এখানে histamine is synthesized from the amino acid histidine. by decarboxylase enzyme. Now, histamine, as said earlier, that is stored in the storage granules of the mast cells by forming complex with the negatively charged particles. Now, histamine is metabolized via two pathways. One is the by methylation. By the enzyme N-methyl transferase, it is converted to N-methyl histamine, and by action of monoamine oxidase, it is converted to methyl imidazole acetic acid. That is the one pathway, and another pathway is the oxidation pathway by the enzyme diamine oxidase, that is converted to imidazole acetic acid. Okay. আর স্টোরেজ সম্বন্ধে অলরেডি বলেছি কোথায় স্টোর হয় কিভাবে হয়। নাও কামিং টু দি হিস্টামিন রিসেপ্টরস, আমরা অ্যাড্রিনার্জিক রিসেপ্টর সম্বন্ধে পড়েছি, অ্যালফা বিটা, অ্যালফা 1, অ্যালফা 2, বিটা 1, বিটা 2, বিটা 3। হ্যাঁ, সিমিলারলি কোলিনার্জিক রিসেপ্টরস, সিমিলারলি হিস্টামিনও তিনটে রিসেপ্টর পরে কাজ করে, প্রাইমারিলি 2, H1, H2, the new one is identified as H3. Now, H1 receptor is basically a GQ protein coupled receptor. GQ protein coupled receptor মানে জানো? কে বলবে কিভাবে কাজ করে জোরে? হ্যাঁ, সরি, হ্যাঁ ওটা তো আছেই, ওরা জি প্রোটিন কাপল রিসেপ্টর, তার মধ্যে ডিফারেন্ট টাইপস রয়েছে, জিএস, জিআই, জিকিউ। জিকিউ কিভাবে কাজ করে? ডিএজি IP3 পাথওয়ে দিয়ে কাজ করে। গুড। তো ওটা দেখ এখানে যাই লেখা আছে, effector pathway PIP2 hydrolysis being converted to IP3, that is inositol triphosphate and diacyl glycerol. That's the pathway of GQ protein coupled receptor. They release calcium from the intracellular stores. The other pathways are protein kinase C activation, and also the H1 receptors are located in the endothelium of blood vessels, and they cause vasodilation by release of nitric oxide via CGMP pathway. So these are the other mechanism. Distribution of H1 receptor in the body, primarily in the smooth muscle. Smooth muscle কি করে? Basically contraction. Okay, contraction of the intestine, so they cause intestinal cramps and colic. Contraction of the airway causing bronchoconstriction and other smooth muscle contraction. Uterus basically humanদের খুব একটা অ্যাকশন হয় না হিস্টামিনদের। Blood vessels, H1 receptors are located in the endothelium of the smaller blood vessels like arterioles, venules and the capillaries, and they release nitric oxide as said earlier. এই pathway NO release CGMP causing vasodilation. Again in the capillaries, H1 receptor cause widening of the gap between the endothelial cells, so the plasma leaks out causing increase in capillary permeability. বোঝা যাচ্ছে রে? And again the smooth muscle of larger blood vessels, arteries and veins, they contain H1 receptor, and unlike in the smaller vessels the H1 was causing vasodilation, the larger blood vessels it causes vasoconstriction. Okay, দুটো অপোজিট মেকানিজম, দুটো অপোজিট কজ রয়েছে, একটাতে এন্ডোথেলিয়ামে নাইট্রিক অক্সাইড পাথওয়ে দিয়ে ভ্যাসোডাইলেটেশন হচ্ছে, আর লার্জার ব্লাড ভেসেলসে বেসিক্যালি H1 receptor is located in the smooth muscle, not in the endothelium, and that is causing vasoconstriction. Okay, next afferent nerve endings. Afferent nerve sensory afferent nerve endings এও H1 receptor থাকে, and that is responsible for itching sensation. Itch করে, causes stimulation causing itching sensation. It also activate ganglionic cell. H1 receptor are also located in the ganglionic cell and the adrenal medulla, and they are responsible for adrenaline release, catecholamine release. And in the brain they are present as they act as transmitter. The H1 receptor are post synaptic receptor in the brain. Okay, now The H1 agonists are 2-methylhistamine, 2-pyridyl ethylamine, 2-thiazolyl ethylamine. No clinical significance. Selective antagonist mepiramine, chlorpheniramine. আমরা পরে পড়ব H1 antagonist সম্বন্ধে। H2 antagonist কোন রিসেপ্টর? GS protein coupled receptor. GS মানে কোন পাথওয়ে দিয়ে কাজ করবে? হ্যাঁ, অ্যাডেনাইন সাইক্লেজ স্টিমুলেট করবে, CMP বাড়িয়ে দেবে, তাই তো? So adenyl cyclase activation increase in CAMP and thus causes phosphorylation of the subsequent enzymes. Now H2 receptors, they are primarily located in the gastric gland and they are responsible for acid secretion and to some extent pepsin. So কি হচ্ছে রে? So acid secretion. They are also present in the blood vessels in the smooth muscles of the blood vessels, causing vasodilatation, unlike H1 receptor. In the heart, in vivo, heart e kono action nahi as such, kintu isolated heart e dekha jay it causes positive chronotropy. Chronotropy mane heart rate বাড়াবে, positive chronotropy, positive inotropy, that means increase in the force of contraction, and basically ঠিক আছে, এটা হলো negative dromotropy, এটা আছে ঠিক আছে। Uterus, in the uterus rat it causes relaxation but no action on the human uterus. In the brain, as a transmitter acting as postsynaptic receptor. The H2 agonists are dimapride, impromidine, and the H2 antagonists, they are cimetidine and ranitidine. এটা উপরে যখন পেপটিক আলসার ড্রাগস পড়া হবে তখন এগুলো আসবে, ঠিক আছে? আমাদের আজকে মেন ফোকাস থাকবে H1 antagonist নিয়ে, right? H2 antagonist primarily used in the peptic ulcer disease, in the gastroesophageal reflux disease, in the gastric hypersecretory conditions. H3 receptors, basically they are GO protein coupled receptor, so they decrease basically inhibit the adenyl cyclase and decrease the concentration of CAMP. Decrease the concentration of CAMP. They restrict calcium influx and they also cause potassium channel activation. Now they are primarily present in the brain as presynaptic receptor, and they inhibit the release of histamine. Okay, so inhibit the release of histamine and thus cause sedation. They are also present in the lung, spleen, skin and gastric mucosa as presynaptic receptor, and they decrease histamine release. They are also present in the ileum and they inhibit acetylcholine release from the mesenteric neuron plexus, and in certain blood vessels they inhibit noradrenaline release, causing vasodilatation. H3 agonist antagonist নাম দেওয়া আছে, বেসিক্যালি কোনো ক্লিনিক্যাল সিগনিফিকেন্স নেই, দে আর ইউজড ফর রিসার্চ পারপাসেস। নাও প্যাথোলজিক্যাল অ্যাকশনস অফ হিস্টামিন। প্রথম, ব্লাড ভেসেলস। অ্যাজ লার্নড আর্লিয়ার, histamine causes vasodilatation of smaller blood vessels by the action of H1 receptor, indirectly by release of endothelial derived release factor or nitric oxide, and partly by the H2 receptor present on the vascular smooth muscles. আমরা আগে অলরেডি পড়েছি, আমরা এখানে কি দেওয়া আছে, H1 রিসেপ্টরে vasodilatation করছে আর H2 বেসিক্যালি vasodilatation করছে, dilatation. So primary action on smaller blood vessels is vasodilatation, partly by H1 and partly by H2. They cause vasoconstriction of the larger blood vessels because of presence of H1 receptor on the smooth muscle. এটা second action রয়েছে। They cause increase in capillary permeability because of presence of H1 receptor in the endothelium. They cause widening of the endothelial gap. Now they causes vasodilatation of the cranial vessels and causing pulsatile headache in the pulsatile headache. Now, injected intravenously, histamine when injected intravenously, they cause fall in blood pressure. Histamine when injected intravenously, they cause fall in blood pressure. When injected subcutaneously, it elicits triple response. Triple response মানে কি? Red spot, wheal and flare. Red spot টা কেন হয়? Because of vasodilatation. Wheal টা কেন হয়? Because of increase in capillary permeability. And flare টা কেন হয়? Because of redness of the surrounding area caused by axon reflex. হার্টের উপরে কি অ্যাকশন রয়েছে হিস্টামিনের? হিস্টামিনের ইন ভিট্রো কোনো এফেক্ট নেই হার্টের উপরে, বাট আইসোলেটেড হার্ট পজিটিভ chronotropy and inotropy is seen primarily by the H2 receptor, and they have got also negative dromotropic effect by the H1 receptor. Dromotropic effect মানে এখানে রে, dromotropic effect মানে কি হবে? Dromotropic effect on the heart মানে increase heart rate. Next, হ্যাঁ, force of contraction হয় inotropic effect টা, heart rate টা হয় inotropic effect টা, হ্যাঁ conductivity. তো বসিয়া বেসিক্যালি কন্ডাক্টিভিটিটা ডিক্রিজ করে দিচ্ছে বাই দ্য H1 রিসেপ্টর. নেগেটিভ ড্রোমোট্রপিক এফেক্ট. visceral smooth muscle উপরে কি হয়? constriction. In the bronchus it causes bronchoconstriction. Patients of asthma are highly sensitive to it. It causes abdominal cramps and colic on large doses because of the intestinal muscle contraction. Human uterus not affected as much as the other visceral smooth muscle. Gland, they cause marked increase in gastric secretion because of the presence of H2 receptor on the gastric parietal cells. Sensory nerve endings, it causes itching when injected intravenously and intracutaneously. At higher doses, more causes pain. তো যেটা আগে পড়েছিলাম কি হিস্টামিন H1 receptor, they are also present in the sensory nerve endings, and because of stimulation of the sensory nerve endings, it causes itching sensation. আর যদি লার্জ ডোজটা ইনজেক্ট করা হয় ডিপার, so it may even cause pain. অটোনমিক গ্যাংলিয়ার অ্যাড্রেনাল মেডুলা H1 রিসেপ্টর থাকে, স্টিমুলেট হলে অ্যাড্রেনালিন রিলিজ হবে, causing rise in blood pressure. Central nervous system, histamine as such does not cross blood brain barrier, so generally no CNS effect is seen, but when injected directly into the intracerebroventricular injection, it causes rise in blood pressure, cardiac stimulation, arousal, hypothermia, vomiting and ADS release. Now pathophysiological roles, প্রথমটা রয়েছে গ্যাস্ট্রিক সিক্রেশন. হিস্টামিনটা কি করে? গ্যাস্ট্রিক গ্ল্যান্ডের উপরে কি কাজ আছে? বল, জোরে বল। হ্যাঁ, তো কি হবে তাতে? হ্যাঁ, বেসিক্যালি parietal cell, they contain H2 receptor. When the histamine is released from the histaminocyte present in the stomach, histamine act on the parietal cell via H2 receptor, and they cause basically release of the acid, hydrochloric acid, from the H plus K plus proton pump, H plus K plus ATPase pump. So non-mast cell histamine present in the histaminocyte in the gastric mucosa close to the parietal cell have high turnover rate. They are released under the influence of stimuli. কি কি স্টিমুলাই আছে যেটা অ্যাসিড সিক্রেট করে? একটা ফিডিং, খেলে অ্যাসিড সিক্রেশন হয়, একটা ভেগাল স্টিমুলেশন, কোলিনার্জিক ড্রাগস, activates proton pump through H2 receptor. H2 blockers or H2 antagonists, they antagonize the secretion of acid by acting on the H2 receptor. Allergic phenomena, mediation of hypersensitivity reaction. Histamine is one of the mediator of hypersensitivity reaction. কিন্তু একা নয়, তার সঙ্গে অন্যান্য মেডিয়েটরস আছে. Histamine is most important. So basically H1 antagonists are effective in controlling these allergic manifestation to a considerable extent, except asthma কোনো রোল নেই. আর একটা রয়েছে অ্যানাফাইল্যাকটিক শক, তাতে কিছুটা এক্সটেন্টে কাজ করে, পুরোপুরি কাজ করে না, সেখানে ড্রাগ অফ চয়েস রয়েছে অ্যাড্রিনালিন. So mediation of hypersensitivity reaction, H1 antagonists are effective in controlling these manifestations to a considerable extent, except asthma and to a lesser extent anaphylactic shock. They are not involved in delayed or retarded type of allergic reaction. Now, this is a schematic diagram showing release of histamine from the mast cell during the antigen antibody reaction. These are antigen, they are bind to the Fc epsilon R1 receptor in present on the surface of mast cell. Antigen antibody reaction occurs, tyrosine protein kinase is activated, that is causing conversion of phosphatidyl inositol biphosphate to inositol triphosphate, causing release of calcium from the intracellular store. Now what does it cause? It causes exocytosis of the storage granules. It causes fusion of the membrane of the storage granules with the plasma membrane. And what happens? The chemicals present in the storage granules are released. Now there the histamine is present in complex form. What happens? The sodium present in the extracellular fluid, they exchange, they basically release histamine free in the extracellular fluid, and thus the histamine release free. Now next, pathophysiological role as a transmitter. We know histamine is present in the brain. They are H1, H2, H3 receptors in the brain. Afferent transmitter. Now number one thing, afferent nerve endings. H1 receptor is there, that is causing itching sensation. So with afferent transmitter initiating sensation of itch and pain at sensory nerve endings. Second is non-mast cell histamine. They are present in the brain. They act on the H1 receptor, H2 receptor which are postsynaptic, and H3 receptor which are presynaptic. H1 antagonist, they have got sedative action. Some of the H1 antagonists, they can cross blood-brain barrier, and what does they cause? They act on this H1 receptor in the brain and causes sedation effect. Because of the blockade of this function, H1 agonism suppress appetite. So in fact, one of the H1 antagonists, that is cyproheptadine, they have got appetite stimulating property. Hence appetite promoting action of some H1 antihistaminics. Histamine also plays a role in regulating body temperature, cardiovascular function and other functions through H2 and H3 receptor. Inflammation আমরা জানি vasodilatation হয়. So mediator of vasodilatation and other changes that occur in inflammation. Also it causes expression of P-selectin on the vascular endothelial cells. P-selectin এর কি রোল? P-selectin it causes chemotaxis of the leukocytes. So basically it promotes adhesion of the leukocytes to the vascular endothelium, sequestering leukocytes at the inflammatory site. Okay. Also regulate microcirculation according to the local needs. Tissue growth and repair. দেখা যাচ্ছে যেগুলো গ্রোয়িং টিস্যুস থাকে তাতে হাই কনসেন্ট্রেশন অফ হিস্টামিন থাকে. তো histamine has been linked to an essential role in the process of growth and repair. Headache, implicated in certain vascular headache but no conclusive evidence. হেডেকটা কিভাবে করে? বলেছিলাম যেগুলো ক্রেনিয়াল ব্লাড ভেসেলস থাকে সেগুলো ভ্যাসোডাইলেট করছে, দ্যাট ইজ কজিং পালসেটাইল হেডেক। Uses of histamine, no therapeutic use. আগে ইউজ করা হতো টু টেস্ট অ্যাসিড সিক্রেটিং ক্যাপাসিটি অফ স্টমাক। আমরা জানি স্টমাকে H2 রিসেপ্টর আছে, অ্যাসিডটা সিক্রেট করবে। তো টু টেস্ট অ্যাসিড সিক্রেটিং ক্যাপাসিটি অফ স্টমাক, ব্রঙ্কিয়াল হাইপার রিঅ্যাক্টিভিটি ইন অ্যাসথমেটিক পেশেন্ট দেখার জন্য, অ্যান্ড ইন দ্য ডায়াগনোসিস অফ ফিওক্রোমোসাইটোমা, সরি, but these uses are obsolete because of high risk associated with it. Beta histine is a H1 selective histamine analog. It is used in Meniere's disease. Meniere's disease মানে জানো? একটা Meniere's disease পেশেন্ট মাথা ঘোরা কমপ্লেন করে, কান দিয়ে আওয়াজ শুনতে পায়, vomiting tendency থাকতে পারে, হ্যাঁ, these are the symptoms of Meniere's disease. So basically beta histine is used to control vertigo and dizziness, in patients of Meniere's disease. How does they act? They act possibly by causing vasodilatation in the internal ear. They are contraindicated in asthmatics. কেন? হ্যাঁ, কেন হবে রে? Bronchoconstriction, good. It's a H1 and basically H1 analog, so it may cause vasoconstriction and increase or exacerbate the asthma. They are contraindicated in peptic ulcer patients, similar cause. Histamine releases. কোন কোন কন্ডিশনে হিস্টামিনটা বেশি মাত্রায় বডিতে রিলিজ হয়? হ্যাঁ, সব থেকে ইম্পর্টেন্ট টিস্যু ড্যামেজ, এনি টিস্যু ড্যামেজ লাইক trauma, stings and venoms, proteolytic enzymes, phospholipase A. Antigen antibody reaction involving IgE antibodies. আগে মেকানিজম দেখলাম, মাস সেল থেকে হিস্টামিনটা কিভাবে রিলিজ হচ্ছে, বিকজ অফ অ্যান্টিজেন অ্যান্টিবডি রিয়েকশন। Polymers like dextran, polyvinyl pyrrolidone, they also release histamine. Dextran basically used as a plasma expanders in clinically. Some basic drugs can also release histamine, like D-tibocurarine is basically a muscle relaxant, morphine, opioid, atropine, pentamidine, polymyxin B and vancomycin, these are antimicrobials. In fact, vancomycin is linked red band syndrome, causes red band syndrome, and even some antihistaminics can release histamine. Surface agents like twin 80 and compound 48/80 release histamine from mast cells. They are called histamine liberators and they may cause anaphylactoid reactions. H1 antagonist, এগুলো হিস্টামিন উপরে হলো। Now আমরা moving to the H1 receptor blockers or H1 antagonist. They are competitive. আমরা জানি অলরেডি কিভাবে অ্যান্টাগনাইজ হয়। It may be competitive, it may be non-competitive. So it is basically a reversible competitive antagonist of histamine at H1 receptor. Majority of the H1 antagonists have substituted ethyl amine side chain. আমরা বললাম কি হিস্টামিন বেসিক্যালি কেমিক্যালি রয়েছে বিটা ইমিডাজোলিল ইথাইল অ্যামিন। ওই যে ইথাইল অ্যামিন র্যাডিক্যালটা আছে সেটা সাবস্টিটিউট করে H1 অ্যান্টাগনিস্ট তৈরি করা হয়। Now, these are the list for the antihistaminics available clinically in the market. Antihistaminics, we divide it into H1 antihistaminics, we divide it into two groups. One is first generation and the other is second generation. First generation, majority of them can cross blood-brain barrier and they have got sedative effect because of that. The second generations are newer H1 antihistaminics available that do not cross blood-brain barrier and hence the sedation effect is minimal. So, among the first generation antihistaminics, they are highly sedative, moderately sedative and mildly sedative. Diphenhydramine, dimenhydrinate, promethazine, hydroxyzine. moderately sedative, phenidamine, cyproheptadine, meclozine, cinnarizine, mildly sedative, chlorphenidamine, dexchlorphenidamine, piprolidine, clemastine. And the second generation antihistaminics, basically those which does not cross blood-brain barrier, they are fexofenadine, loratadine, desloratadine, cetirizine, levocetirizine, azelastine, mesolastine, avastine and rupatadine. These are the drugs H1 antagonist. Pharmacological actions চলে আসি। হ্যাঁ, আচ্ছা এখনো পর্যন্ত কোনো জিজ্ঞাসা করা আছে রে? Any problem? Antagonism of histamine, they block histamine induced bronchoconstriction, contraction of intestine and other smooth muscles and triple response. Basically antagonize করতে histamine action গুলো। Anti-allergic action, many manifestation of hypersensitivity reactions are controlled except partial control of anaphylactic shock and except asthma. CNS effect, they cause variable degree of CNS depression because first generation antihistaminic they crosses blood-brain barrier. Okay, so first generation antihistaminic they produce variable degree of CNS depression, ability to cause blood-brain barrier and affinity to bind to the central H1 receptor. Because of that, individual susceptibility to different agents are different, they vary considerably. Now we know that first generation antihistaminic they cause sedation effect, but to some individual it can cause excitement, restlessness, insomnia even. Excitement and convulsions are frequently seen at toxic doses. Second generation drugs are practically non-sedating. Why? Because they does not cross blood-brain barrier. Certain H1 antihistaminics are used in motion sickness. তার কারণটা হচ্ছে দুটো কারণ হতে পারে, একটা তো অ্যান্টিকোলিনার্জিক এফেক্ট। সাম first generation antihistaminic, most of them they show anticholinergic effect, or because of histamine antagonism in the brain that may also be responsible for motion effect in the motion sickness patient. Promethazine also control vomiting of pregnancy, right? Promethazine and few other antihistaminic they control tremor, rigidity that are associated with Parkinsonism. Okay, possibly because of anticholinergic and sedative property. এগুলো এফেক্টটা পার্কিনসনিজমে বা মোশন সিকনেসে সেকেন্ড জেনারেশন অ্যান্টিহিস্টামিনিক কোনো রোল নেই। কেন? বিকজ দে ডু নট হ্যাভ গট এনি অ্যান্টিকোলিনার্জিক এফেক্ট। Some older antihistaminic, especially cyproheptadine, basically H1 antagonist রয়েছে, তার সঙ্গে it has got 5H2 receptor blocking action. 5HT2 মানে সেরোটোনিন রিসেপ্টর। সেরোটোনিনের তিনটে রিসেপ্টর আছে, 5HT1, 5HT2, 5HT3, একটা 5HT4 ও আছে। তো 5HT2 রিসেপ্টরকে ব্লক করে other than the H1 receptor antagonism, and thus they have got appetite stimulating property. Some H1 antihistaminics are also effective antitussives, কফে উপরে কাজ করে। Anticholinergic action, many H1 receptor blockers first generation have got anti-muscarinic action. High H1 antihistaminic with high anti-muscarinic actions are promethazine, dimenhydrinate, diphenhydramine and phenidamine. And when these drugs are combined with atropine and its substitutes or other drugs having high anticholinergic activity, the side effects pile up or add up. Local anesthetic, some antihistaminics, first generation antihistaminics, they have got membrane stabilizing effect like promethazine, diphenhydramine, phenidamine. So they may show local anesthetic effect, but they are not used for it. Why? Because on subcutaneous injection it causes irritation, so they are not used. And because of this membrane stabilizing property, they also have anti-arrhythmic property. Got blood pressure. On IV injection it causes fall in blood pressure. Direct, because of the direct the two causes are there, either because of the direct smooth muscle relaxation by antihistaminic effect and also by alpha adrenergic blockade. So, some antihistaminics have also got alpha adrenergic blocking property, particularly promethazine. Promethazine has got significant alpha blocking property. So, that can cause fall in blood pressure on intravenous injection, but however not evident on oral administration. Although some degree of orthostatic or postural hypotension may be there in susceptible individual. Pharmacokinetics, most of them are administered orally, while some can be used intravenously or intramuscularly. They are basically absorbed well from the oral and parenteral route. They are distributed widely in the tissues, including the brain. Although the newer drug does not enter brain, duration of action for most of the drugs are 4 to 6 hours, except certain drugs they have got longer action. Side effects, one is CNS side effects. First generation antihistaminic, they crosses blood-brain barrier and they cause sedation, diminished alertness and concentration, lightheadedness, fatigue, tendency to fall asleep. So, the person on first generation antihistaminics, they are told to be cautioned not to use or operate motor vehicles or machineries, but is not applicable on second generation antihistaminic. Alcohol and other CNS depressant, they add up to the CNS depressing action. Now, few individuals become restless and nervous and unable to sleep. Regular use of first generation antihistaminics are not advisable. Why? Because of CNS depressant property that can lead to interference with learning and academic tasks. Side effects are although mild and some tolerance to the side effect develop on the repeated use of the antihistaminic. ঠিক আছে রে, এটা গেল সিএনএস সাইড এফেক্ট। তাছাড়া কি হতে পারে, অ্যান্টি মাস্কারিনিক সাইড এফেক্ট হতে পারে। অ্যান্টি মাস্কারিনিক কি কি সাইড এফেক্ট হবে? ড্রাইনেস অফ মাউথ হবে, ঠিক আছে, আর কি হবে? very important effect, dryness of mouth, alteration of bowel habit, ठीक है, blood vision, hesitancy. Now, epigastric distress and headache may also be felt. Some drugs like hydroxyzine, cyclizine, fexofenadine are teratogenic in animals, although in humans not documented. Caution is needed in prescribing antihistaminic in pregnancy. Toxicity, acute overdose, basically cause central excitation, tremor, hallucination, muscular incoordination, convulsion, CNS effect, flushing, hypotension, fever and some other features of belladonna poisoning, anti-muscarinic effect. Death is due to respiratory and cardiovascular failure. Now coming to the second generation antihistaminic, how they differ from the first generation antihistaminic? Number one thing, H1 blockers marketed after 1980 with one or more of the following properties. তিনটে প্রপার্টি দেওয়া আছে, তার মধ্যে কোনো একটা হতে হবে। একটা, absence of CNS depression property, number one. Number two, higher H1 selectivity, মানে anti-muscarinic action minimal হবে, alpha blockade property থাকবে না। So higher H1 selectivity, no anticholinergic side effect. They should be having additional anti-allergic mechanism apart from the histamine blockade. এই তিনটের মধ্যে একটা থাকলে, আর যদি 1980 পর থেকে মার্কেট করা হয়েছে, দ্যাট আর সেকেন্ড জেনারেশন অ্যান্টিহিস্টামিনিক। দে হ্যাভ আ ন্যারো স্পেকট্রাম অফ ইউজফুলনেস। কেন? ইট ডাজ নট হ্যাভ অ্যান্টি মাস্কারিনিক অ্যাকশন। তো এটা মোশন সিকনেসে, ভমিটিং ইন প্রেগনেন্সিতে কোনো ইউজ নেই। হ্যাঁ, their principal indications are allergic rhinitis and conjunctivitis, hay fever, pollinosis, urticaria, dermographism, atopic eczema, acute allergic reaction to drugs and foods. They have poor appetite and antiemetic and antitussive action. Coming to fexofenadine, it's an active metabolite of terfenadine. And H1 antihistaminic, basically terfenadine was the first second generation antihistaminic that has been withdrawn or rather banned from the market. Why? Because they block the delayed rectifier potassium channel and at high doses that can lead to prolonged QT interval and polymorphic. बोल रहे हाँ हाँ 10 मिनट কটা নাগাদ আচ্ছা তাতে শেষ করছি রে তো but they, basically terfenadine and astemizole they have been withdrawn from the market because they cause potassium channel blockade causing ventricular tachycardia, so they have been withdrawn. Now fexofenadine is an active metabolite of terfenadine. They do not block the delayed rectifier potassium channel. They does not prolong QT interval. They do not penetrate blood-brain barrier. Oral absorption rapid, mainly excreted in urine and bile. Loratadine is again a long-acting and fast-acting H1 antihistaminic. They does not produce cardiac arrhythmia, although seizures have been reported. No interaction with macrolide or antifungal. They are got good efficacy in urticaria and atopic dermatitis. Desloratadine is an active metabolite of loratadine. Cetirizine is a metabolite of hydroxygen with marked affinity to peripheral H1 receptor. Eta cetirizine royeche basically it gets high concentration in the skin, so they have got superior efficacy in urticaria and atopic dermatitis. Now they have got additional mechanism other than the histamine blockade. They inhibit release of histamine and cytotoxic mediator from the platelet as well as eosinophil chemotaxis during secondary phase of allergic reaction. Levocetirizine is an enantiomer of cetirizine. Azelastine বেশিরভাগ ইউজ করা হয় nasal route দিয়ে, nasal spray দিয়ে. So they have got good topical activity. They are newer H1 antihistaminic. They inhibit histamine release and inflammatory mediator reaction triggered by leukotrienes and platelet activating factor. আমরা পড়েছিলাম কি সেকেন্ড জেনারেশন অ্যান্টিহিস্টামিনিক they may inhibit the histamine blockade and they may act in the allergic reaction by other mechanism also. So azilastine, cetirizine, they are this group of drugs. They also down regulate ICAM1, that is intercellular adhesion molecule 1 expression on the nasal mucosa. Metabolism inhibited by CYP3A4 inhibitors, active in seasonal and perennial allergic rhinitis. Mesolastine is effective in allergic rhinitis and urticaria. Avastin active in nasal and skin allergies. They have got active metabolite carbostine. Rupatadine, allergic rhinitis. Uses of antihistaminic in allergic reaction do not suppress antigen antibody reactions, but they inhibit the action of histamine released from the antigen antibody reaction. Action is slow, so they are not useful in the anaphylactic shock where adrenaline is helpful. They are not effective in bronchial asthma. Type 1 hypersensitivity reaction to drugs is suppressed by the antihistaminics. They also block symptoms produced by histamine releases. Older antihistaminics, that is first generation antihistaminics, they remain the drug of choice for idiopathic pruritus. They are also helpful in common cold, but not the newer antihistaminics. They are less effective. They have got prophylactic value in the motion sickness, particularly promethazine, diphenhydramine, dimenhydrinate and meclizine. Cyproheptadine, they have got appetite stimulant effect because of the blockade of H1 receptor and the 5-HT2 receptor. Promethazine, because of its anticholinergic and sedative property, they are used as pre-anesthetic medication. They are also used in first generation antihistaminic. They are also used in various cough syrups, particularly chlorpheniramine, diphenhydramine and promethazine, because of anticholinergic and sedative property. Vertigo, particularly cinnarizine and dimenhydrinate, first generation antihistaminic. They are the most commonly used labyrinthine suppressant for vertigo. Parkinsonism, as already discussed, because of anticholinergic effect. Promethazine and some others afford mild symptomatic relief in early cases, particularly in tremor associated with Parkinsonism. Acute muscle dystonia relieved by parenteral promethazine, diphenhydramine and hydroxygen as sedative, hypnotic and anxiolytic effect because of CNS depressing property.